Hello, I'm Megan Monke, the Chief Marketing and Communications Officer for Intermountain Healthcare. Today we've asked Intermountain President and CEO, Dr. Marc Harrison, to join us to share an announcement and some comments on upcoming change for our organization. With that, let's jump right in. Marc, thanks for taking the time today. I know you have an update to share, so please, what news do you have to share with our caregivers?
Well, Megan, thanks for taking the time to be with me. My news is that after really careful consideration and boy, some soul searching, I've decided to leave Intermountain this fall, late this summer, early this fall. I'm going to leave this great institution to go and start a new company along with a group called General Catalyst. I'm going to start a healthcare platform company that will serve the same values, the same goals that we've served here at Intermountain for the last 6 years. The company will address equity, it'll address access, it'll address affordability, it'll address quality, and it do so in a borderless fashion. And maybe most important to me, in addition to taking care of all people, just like we do at Intermountain, the intention is for it to work in concert with healthcare systems, not in competition with them. So here, I'm a guy who, my entire career, I've been interested in making impact, and I couldn't be prouder of the work we've done together here at Intermountain. This has been the best 6 years of my life professionally that I could ever imagine. That said, I can see an opportunity here. And while Intermountain is strong, that's the time for me to walk away, as hard as it is, and to take this next big challenge on.
Marc, you've been here for 6 years and have worked with the team to accomplish some amazing things. What are you most proud of?
So I hope this doesn't surprise you, Megan. I'm most proud of our people. We've had a lot of opportunities over the last 6 years to get to see what our caregivers are really made of. I've gotten to see them transform the organization to be prepared for the future. Really hard and disruptive at times. But people, by and large, have just done a magnificent job, positive and thoughtful, forward-leaning, and we've been wildly successful, most importantly in the arena of quality as we've done that. Together, we've taken on the pandemic. And again, are we perfect? No, but I don't know of a single system anywhere in the world that has done better than we have. We got great clinical results. We played as a team. We took advantage of the One Intermountain transformation, and we coordinated across this giant system. And our people, our caregivers, have made it possible for us to grow into new areas. Because of our success, we've been a magnet for good growth that's designed to drive value to the people we serve, our communities, our members, our patients, our caregivers. And now we're privileged to be in 7 Intermountain states. And the future is so bright. All of this boils back down to our people. And boy, am I proud of them.
Your pride definitely shows. It hasn't all just been business. You've mentioned how you've seen the heart of Intermountain. What do you mean by that?
So the heart shows in different ways. One of the things I love, and I've done a lot of, is I've rounded. And hearing the individual stories from the individual people, it really strikes home. And I will say that's probably the thing that I'm going to miss the most. You know, I'm a doctor. I grew up in a medical family. I've known nothing but clinical care my entire life. And the idea that I'm not going to get that fix, that rush of human touch on a day-to-day basis, that's actually really tough. I've seen the soul and heart of Intermountain expressed in small ways that are really profound. You know, when I hear a story about an environmental services person who gives her shoes to a patient who doesn't have shoes and needs to get out of the emergency department and needs shoes to do so, and our person, our caregiver, gives that person something personal of themselves. It's incredible. I've seen it on a philanthropic standpoint, the generosity that our caregivers show towards the system, as well as our communities, amazing. And then I see the personal sacrifice that each and every one of our folks have made. Probably best exhibited during the pandemic. Times of uncertainty, times of anger, times of confusion. Our folks, our caregivers, always revert back to doing the right thing for another person. And what more can a leader ask for?
The focus on community and equity has been a passion of yours and a mission of Intermountain. Could you talk a little more about that?
Yes, one of the great dividers in our society historically, but also in the current context, has been really this polarization that has occurred around how to address people with different belief systems or different backgrounds or different socioeconomic circumstances. And as a clinical organization, an organization that provides health insurance, provides care, provides support to communities, I love the fact that we together have decided to make equity a value and a fundamental at Intermountain. And we've done so in just the right way. We haven't fallen into the trap of making this a political argument. We've addressed it clinically. We've said to ourselves, why should somebody with a different color skin have a higher risk of maternal mortality? Why should somebody who speaks a different language at home have poorer stroke care than somebody who speaks English? Why should a rural person have less access to good behavioral health services than somebody who lives in an urban area? And by making these things very clinical and very human, we've demystified a lot of the conversation, and I'm seeing incredible productivity. And I don't mean like volume, like seeing lots of patients, but productive conversation, that kind of productivity around these really tough issues in ways that bring us together, not pull us apart.
Marc, you've often been described as an eternal optimist. As you leave, what makes you so optimistic about the future of Intermountain Healthcare?
So first I'll say, when people describe somebody as an eternal optimist, sometimes that paints that person in an unrealistic light, right? This person's a Pollyanna, everything's gonna always end up okay. Let's remember, Megan, I'm a pediatric critical care doctor. My job is to always assume the worst clinically and always be ready with plans A, B, C, and D if things don't go right, and to be strong and aggressive and assertive clinically. And I'd like to think that based on what I've seen from Intermountain, I have every reason to be completely optimistic about our future. We've improved our clinical quality. We've grown our footprint. We've invested heavily in our caregivers. I'm so proud of what we've done around things like parental leave, around things like educational benefits for all of our caregivers. I'm optimistic because we have the best 60,000 people in the world working at Intermountain, and they're doing the best work in any legacy health system in the country. And I'm optimistic because of all the successes we've had to date, and I can absolutely clearly see the successes that lie ahead. So I'm confident in all of you that we working together, you working together, are going to make an enormous difference.
So Marc, tell us about you. What does the future hold?
Well, I will confess that for the first time since high school, I'm going to probably take a little break. And I'm hoping that Mary Carol and I will get a chance to take a couple of months and see family, maybe travel a little bit. She's back in school again. She's an undergraduate in Spanish. Despite the fact that she's a practicing pediatrician, she is going back for another undergraduate degree, and she wants to do an immersion experience and to perfect her Spanish. We'll probably do that. We'll want to go to the desert. We may go down to South America and do a bike trip. We've got a lot of really nice plans, but mostly it's to do that regenerative unplug that I think will be really good for me and prepare me to go all in on creating this next endeavor. And I can't be really specific about it for a number of reasons. But what I can tell you is I've never done anything small in my entire life. And if I'm going to leave a place as terrific as Intermountain Healthcare, and believe me, this has been brutal to make this decision, I'm going to make it worthwhile. And I'm going to take the opportunity for this interlude of good health that I have to go all in on creating an organization that is going to impact millions and millions of people across the country and around this world to have better access to healthcare, more affordable healthcare, more equitable healthcare, and to do so in a way that makes systems like Intermountain healthier, not weaker. So that's what the future holds.
I've heard you talk with immense pride about our caregivers here at Intermountain Healthcare. I've also heard you talk about the pride you feel in our executive leadership team. Can you tell me a little bit about how you feel about the team and your thoughts for the future?
Thanks, Megan. This is something I feel really strongly about, and I have immense respect for our executive leadership team. And we've been forged through fire in a number of ways. So whether it was what was the Intermountain executive leadership team really coalesced around my illness. And so when I was sick and when I was out, they stepped up and worked together in the most beautiful way. Each of the two legacy teams did remarkable work during the pandemic. But what has really brought us together is this integration work. And there is one team at the top at this point in time. And what I see is selflessness and humor and genuine affection and great work ethic, free flow of ideas. It's powerful. It's palpable. And I think it's going to stand the organization in really, really good stead. So, I try not to use unnecessary hyperbole, but this is the best leadership team in healthcare. They are composed of human beings, which means by definition we are all imperfect. But man, when you put this group of human beings together, they can do anything. They have and they will.
That's a great message to end on. And on behalf of our caregivers, I just want to thank you for all your leadership and all you've done for Intermountain and the communities we serve. I think we're all excited for the next adventure, but you will also be missed dearly. Best of luck to you. Together, we will continue to celebrate the bright future of Intermountain Healthcare.